In this video, what we're going to do is we are going to continue with the theme of how you evaluate information in nutrition. But I'm going to actually show you a trick that you can use to avoid having to do what I just showed you, which is going into the scientific literature and counting clinical trials. It turns out the Federal Drug Administration, FDA, the FDA goes through a process very similar to what I just showed you, and the outcome of their process for the language that's on the labels of food looks almost identical to the process that you've gone through. So if you know how it is that the process ends up in certain statements on the labels, you can use it as a shortcut so that you don't have to go and look up the step yourself. So here's 4 different examples that you might see on a food label. All 4 of these have come from packages. It might say heart healthy, it might say it boosts your immune system, it might say that it lowers cholesterol, or it might say that it reduces weight with lots of little hash marks after the statements. So by the end of this video, you're going to find out which is the one that actually has some scientific evidence to back it up, even without reading anything in the scientific articles. Okay, so to get to that spot, here's what I'm going to do. We're going to start by talking about how the FDA defines food, supplements, and drugs, because knowing which type of thing that you're looking at can help you. It is important for evaluating the statements that are on the products. So once you know the definitions, then I will show you how the FDA views those particular products and what decisions it's made about what it's going to expect as proof from the manufacturers. Then we're going to learn the vocabulary that the FDA has to tell you what the relative amount of evidence is for particular claims. That is health claims, qualified health claims, and structure function claims. Those are the 3 categories that they recognize. Then once you know what the categories are, we're going to look at what the signal phrases are that are on the labels so that you can know, this one has a bunch more research than the others. And then finally, we're going to look at some more detail of how it is that the FDA decides which of those categories of claims to look at. And I think what I want to convince you of when you see those criteria is that it looks like what I just showed you. Okay, and finally, when we finish this, you're going to take your quiz, and then in class we are going to use the type of claim on a product label to evaluate these supplements that I'm having you look up. Okay, so let's start with how the FDA defines things that you put in your mouth. Okay? Things we ingest. That's what the Food and Drug Administration is concerned with. There's other regulatory bodies that regulate other products that we buy, but the FDA's job is to regulate food and drugs. So the FDA divides the universe of things into 3 groups: foods, dietary supplements, and drugs. And the definition of it is based on what the intention is to do with that product. So if you put something in your mouth because it's going to provide basic nutrition. In other words, calories, micronutrients, things like that. That's called a food. If there's something that you need in your diet that you're not getting from it, or maybe you want more from your diet of something that you could possibly get just by eating the food, those things are called dietary supplements. And drugs. Drugs are also things that we take, but they're different from dietary supplements and foods because the purpose of our taking them, our intention, is that by taking them, we will somehow affect the course of a disease process, either curing it, preventing it, whatever. It also recognizes drugs as those things that intend to alter the function or structure of your body. And that function structure statement is going to come up again. Okay, so once it's laid out these intentional categories, what you will see is that there's some overlap. So the FDA had to come up with some additional criteria, especially when dealing with dietary supplements, because they sort of do both things. They are both foods and in some ways drugs. So dietary supplements differ from foods, or actually the same as foods, because what they have in them is food-like substances, things that you would normally get in your diet. Vitamins, minerals, herbs, other things that come from plants, amino acids, anything else that you would get from your diet. Okay, what's not in there that drugs do have is synthetic chemicals that have been designed. So dietary supplements have the components of foods. But dietary supplements are different from food because they come in a form that's not food. Tablets, capsules, soft gels, liquids, or powders. If it's in any of those forms, that's what makes it not a food. So even though dietary supplements are separate, you can see that dietary supplements in some ways look like foods because they're providing the same things that you would normally get from foods because of the restriction on the content. And then the other thing is that they look, though, like drugs. The delivery system comes in a form that could be cough syrup or coated tablets. They look like drugs, but they're not because of their content and purpose. Okay, so this becomes really important because which of those three classes it's in, foods, drugs, or dietary supplements, determines the rules that the FDA has for manufacturers of those products about what they can put on their labels. And the rules that they have determine how much you can rely on the information that's in those labels. If the FDA monitors it, then it means that you can count on it, and we'll learn how much you can count on it. The FDA actually gives you guidelines for extent. What the FDA is charged with is it monitors the safety of the things that we ingest, and it monitors the efficacy of the things that we ingest. So let's start with safety. How does FDA monitor safety? So for foods, manufacturers can't sell brand new food products until they have been proven that it's safe. So the manufacturers, the burden is on them to prove it to the FDA that's safe, to come up with the data that shows it's safe. Otherwise, they cannot sell their products in the United States. That's for foods. So when would there be a new food? Well, if you think about it, there have been a lot of new foods coming from foreign countries that you've seen in your supermarket lately. And that's changing all the time. We certainly did not see acai berries before just a couple of years ago. Drugs. Drugs are monitored in the same way that food is. Drugs cannot be sold until the manufacturers have the data to prove to the FDA that it's safe. Dietary supplements, on the other hand, can sell their products without checking in with the FDA. The FDA instead has a policy that it's up to the manufacturers to prove that it's safe, but they just have to prove it to themselves. And if it ever turns out that the product is not safe, then the FDA is actually the one who needs to prove to the manufacturer that it's unsafe. So imagine the burden of a government body having to prove that all of the supplements that are sold in the United States are unsafe. Of course, it doesn't. What it does is when reports come from physicians that people are being harmed by a particular supplement, then the FDA, if there's enough of it, will take some of its resources and will try to stop that. And they have done that in the past. But it's strictly based on which supplements make the most noise. So as long as you don't have something that's causing a big scandal, you can probably fly under the radar. Okay, so FDA requires proof of safety for foods and drugs. So the next issue is claims. What are claims? Claims are a statement that is made where you claim a connection between your product and something that it does. So when you have a product and you want to tell people why they should consume that product, you might put a little statement on your label that advertises what health benefits you could get from this particular food, and that's really why people take food in the first place. So in order to put that language on the label to try to get more people to buy your food, because it makes them healthier, if you are a manufacturer of food, the statements must be pre-approved by the FDA for health benefits. Can't do it, gotta get permission first. For drugs, same thing. Drugs manufacturers have to go through these prolonged clinical trials. First they check it to make sure it's safe, and then when they've cleared that hurdle, then they have to go through clinical trials, compare placebos to experimental, the treatment group, and show that the outcome is different for people that take the drugs than don't. And if it's not effective, the FDA won't allow them to sell it. Okay, dietary supplements, on the other hand, they can't make health claims. Okay. Drugs can make health claims, food can make health claims. Dietary supplements are forbidden from making health claims. Now why? If you think about it, remember that dietary supplements look like drugs. So if they are going to make a health claim, then they are going to be classified by the FDA as drugs. Okay, you want to claim to cure disease and you look like a drug, go ahead, submit the information proving that your supplement cures whatever disease you want to say. And any supplement that strays on their label into language that makes it sound like they're trying to make a health claim will get threatened with being pulled from the market until they can prove to the FDA that they're effective. And of course, when they're faced with that, what happens is the supplement manufacturers will change the language on their labels, but only if they stray over that line into language that qualifies as health claims. And we'll talk about what that is. So for health claims, they can't make those statements, but if they make structure function claims, there's no FDA review. Okay. So for food and drugs, the FDA requires proof of claims, but for supplements, once again, it's up to the manufacturer to have evidence that convinces them, and the only time that they will ever be regulated is if the FTC thinks that they are using misleading advertising, or if they stray into the area where the FDA thinks they're trying to convince people that they're effective. All right, so the reason that I went through that was to build the foundation for the types of evidence that's required depending on what type of claim you're making on your label. So first, let's talk though about the claims themselves, the types of claims and what types of statements you can make. Okay, so I'm going to talk first about health claims. Health claims are those claims that correlate either an ingredient in a food or a drug and its effect on disease, or on, in the case of drugs, on structure-function relationships. Okay, so a health claim will say this food cures this disease, prevents this disease, things like that. So an example of a health claim is that diets low in fat and rich in fruits and vegetables may reduce the risk of certain cancers. And I think you all by now recognize that risk is a word that conveys that people who engage in certain behaviors, like eating fruits and vegetables, if you compare them to people who don't eat as much, the people who eat fruits and vegetables are less likely to have cancer. And the place where that you would see this, a statement like this, is on fruits and vegetables, of course, but only if those fruits and vegetables were low in fat, because that is what the data says. Okay, now there's another type of health claim. It's called a qualified health claim, and it looks just like the health claims. It will make an obvious connection between the food or the food component and the it will use reduce the risk, and it will say what the disease is. But it will start out with different language. It will say that the evidence suggests but does not prove. This is called a qualified health claim because it's got the health claim that you see here, but with this extra phrase here, it qualifies the statement to let you know the degree of certainty. From the point of view of the FDA, it has not been proven yet, whereas, as we'll see, this one has. Okay, structure function claim is a claim that does not tie the food to a particular disease. Instead, it will say you need this food because it helps to, it's involved in building the structure in your body, or it helps a normal system to function. Okay, so So examples are, here's the structure. Calcium builds strong bones. So bones is the structural component of your body, and calcium is part of that process. Okay. Fiber maintains bowel regularity. Now notice that it doesn't say fiber prevents constipation. It says there's your regular bowel process, and fiber is part of maintaining it, or maintaining it significant. Finally, this one. This is the favorite word, support. Naturally rich in antioxidants, vitamins A and C help support a healthy immune system. So support is the generic word, which means assist. It doesn't necessarily mean interacts. And it certainly doesn't say that it's going to cure or prevent disease. Okay, so now that we know what they are, the type of claims determine the criteria that the FDA requires of manufacturers to submit before they will allow them to do it. Okay, now remember that if it's a structure function claim, the FDA requires nothing from them. They have to have the information on hand. They can't go out on a limb and say something unless they have some sort of evidence to back it up. But as you'll see, all the regulatory bodies are looking for is just that the manufacturers have some reason for saying it, whatever it is. It could be something that Diane Sawyer said on 2020. They just have to have some reason. But for health claims and qualified health claims, the criteria are pretty exacting. So to support a health claim, the FDA requires that the manufacturers submit to them the claims, what they hope to ask for approval. And what the FDA will do is they will take their filing, and if they agree to hear it, because they've limited its resources, what they will do is they will get together a panel of experts who will go through and do a scientific literature review. They will pull all of the articles, probably using PubMed and Medline, just like you did. So they will go and find all of the articles that are relevant to the topic, and they will sit around and rate those articles, and among themselves determine if the evidence that they can find meets the significant scientific agreement standard. And that's a word just like reasonable, beyond reasonable doubt. It's something that is explained to the people who are part of that panel. So a health claim has to pass the sniff test of a panel of experts who are called and who are qualified because of their professional training to actually read those papers that everybody else just sort of did. You can just sort of skim. Okay, so if a health claim goes to the FDA, and if for some reason they look it over and they say, well, we can't just outright reject it because it looks like the evidence is on the brink. Maybe with just a couple more studies, it might pass the test. In that case, what the manufacturers can do is to put that qualifying statement on there that evidence suggests but does not prove. And that will allow them to make a statement that's a little bit stronger than a structure function statement or making no statement at all. All right, so let's get back to this issue of the structure function claims. Remember, after telling you about what's required for health claims and qualified health claims, that it's up to the manufacturers to prove to themselves that there's evidence for their claim, their structure function claim. So I'm going to use an example that I got for the Center for Science and the Public Interest, which is sort of a watchdog group that makes sure that manufacturers aren't overstating the nutritional information that's out there. So in their report, they were talking using this food here as an example. So Green Giant says on its label, it's a type of mix of vegetables that's called Immunity Boost. Okay, so here's what's in it. But how is it that it says that this boosts your immunity? It says it's naturally rich in antioxidants, vitamins A and C. So vitamins A and C are the antioxidant enzymes along with vitamin E to help support a healthy immune system. Support a healthy immune system. So this is a structure function statement. So let's look at what evidence the manufacturer gives to support their statement that that's what it does. Here's what they said. It's well documented that vitamin A and vitamin C play an important role in supporting immune function. Okay, so if they're convinced, they say it's well documented, done. They're convinced. All right. So let's look at what the clinical trials say. The clinical trials, there was one large clinical trial that had 2,300 people, so it's a good sample size, certainly greater than 300. And they had it randomly assigned to treatment and control. And they used a daily multivitamin that had vitamins A, C, and E. Those are the three antioxidant vitamins. And the control group took a placebo. So what they did is with this group of people, they tracked their visits to the doctor for 18 months. They looked not only at their reports of illness, they also, this trial was done in countries, socialist countries, where they track sick days. So they tracked their illness, they tracked the number of days they called in sick to work, and they also tracked the number of visits that they made to the hospital, which were all government funded. So they did that for 18 months, and what they found is when they compared the treatment and control, there was no difference between the groups. So here's the manufacturer. It says everybody knows vitamin A and C helps boost your immune system. Everybody knows that. But the clinical trials say that there's no effect. All right, so what does it take to meet SSA? SSA is the criteria that the FDA uses, significant scientific agreement. What does it look at? First of all, it looks at the type of studies that are out there. Clinical trials are the best. Correlational studies are second best. And they will not give approval to health claims unless if the only evidence that they have are animal and cell studies. That should sound familiar to you. They look at the number of studies. Are there enough studies that repeated the results for it to be deemed reliable? And the quality of studies. Was it double blind? Was the sample size large enough? The effect size. In order for the FDA to give approval, it has to make a significant amount of difference in your health. If it lowers cholesterol by 1%, that's not significant enough. It has to be pretty pronounced to make it worthwhile. And finally, the studies have to be able to agree with each other. If you've got some studies say yes, some studies say no, that's not good enough. The studies have to agree with each other. So let's see what you've learned. Here are the 4 labels, which I showed you at the beginning. So just by looking at the labels and looking at the language that's on the labels, which claim has met the FDA's SSA standard? That's right, Cheerios. Cheerios is the only one that had no asterisks. It's the only one that actually used active words, not help support, help maintain. It actually makes the claim that your cholesterol goes down. That's a structure function statement, but it's actually something that changes the progression of the disease, and so that's why they're allowed to make the health claims. So in conclusion, health claims on U.S. foods. If food is sold in the U.S. and there's a health claim on it, and by health claim I mean not qualified health claim, not structure function claim, it means that a panel of experts has sat around and reviewed the literature for you, and that you can count on that information on the labels to be true, to the best of our ability. However, if products are sold in the United States and they have structure function claims, those claims have not been reviewed by anyone except the manufacturer. And you don't even have to look for the language. If it's a supplement, any health statements that they've made, even structure function claims, have not been reviewed by anybody, and you should not rely on them.